Hello, I'm Zoe Schroeder, your registered dietitian here at Tucson Weight Loss Surgery. And today we're going to be talking about fluid strategies to reach that 64 ounce per day fluid goal that you have. Maybe you're having a little bit of trouble meeting it, and so this video is for you. So let's talk about why you might have a hard time reaching the 64 ounce per day goal. Maybe things taste different, they taste funny. Maybe you're not thirsty, or you forget to drink, or maybe your drinking is painful and it hurts to drink. So we're going to talk through each one of these potential issues and what we can do to make sure that you do not get dehydrated. Okay, so if you are experiencing taste changes, which is super common post-surgery, so don't be concerned, it might be that you dislike the taste of this specific water, or maybe the water tastes too sweet. So something to try is alkaline water. Now, alkaline water is basically, the pH is different than normal water. And so your taste buds sense it differently. Still 0 calories, still just good old water, but because the pH is different, your taste buds will sense it differently, and that might be more palatable to you. Something else that you can try is fruit-infused water, or also known as spa water. These jazz up your water without adding sugar, without adding calories. It just adds the flavor and the essence of those fruits. And you can try all sorts of different combinations, play around with it, see what you like the best. And you can also look on Pinterest for lots of different inspiration of different spa waters or combinations that you can try. But that's a really great way to make water taste better if you don't like the taste of water. So you can also try herbal tea. Now, we're not adding any sugar or honey to it, but just the plain herbal tea is something that's going to help add some different flavor that might make drinking more pleasurable to you. And then also you can try broth. Broth is great because it's more on that savory side versus the sweeter side. So if things are so sweet and you don't like them, maybe you want to go a little bit more towards the savory, salty side. Okay, something else that you can do is dilute your favorite calorie-free beverages with water. So take, for instance, Gatorade Zero or Vitamin Water Zero. Those things might taste too sweet. So what you can do is dilute it with plain water, and then that helps you drink some more, add some flavor without it being too sweet. Just make sure that it's non-carbonated. Okay, so what if you are just not thirsty or you forget to drink? This is going to be something that might be pretty common, but we want to avoid it at all costs, because if you feel thirsty, you're probably already dehydrated, and we really don't want you to get dehydrated. So if you're waiting till you're already thirsty, you're going to be behind. So what you can do is actually drink according to a set schedule. Or what I really like to recommend are setting some alarms either on your phone or on your smartwatch for every hour or every 15 minutes to remind you to drink. That's a really great tip and something that a lot of people find really beneficial. You want to break up your 64 ounce fluid goal into more manageable pieces. So if we think about that 64 ounces in 16 ounce water bottles, that's just 4 water bottles. Or if we think about that 64 ounces broken up into 8 ounce glasses, that's going to be 8 glasses, right? So when you break it down into more manageable pieces, you can then structure that into your day as well. So if you're just trying to get through those 4 water bottles a day, then you can say, okay, got to take 2 hours to drink this 1 water bottle, the next 2 hours to drink the next one, and so on. Or if you are doing the 8 to 8 ounce glasses, maybe you want to do every hour drinking 1 glass. Whatever works for you, you should do it. Just make sure that you get those 64 ounces in. Something else that a lot of people find helpful are those motivational water bottles, where you have your whole jug for the day and there are tick marks with inspirational quotes along it, or motivation to keep you going. I've also seen some that have time on there, so it says 8 a.m. just starting off, 10 a.m. you've got this, so that you can drink according to your schedule, but it says it on the water bottle. So find a water bottle that you like if that's something that suits your fancy, and it can be a fun way to get your fluid goal in. We want to make sure you are drinking intentionally and not reactionarily. So what do I mean by that? Drinking with the intention to reach your goals and to not get dehydrated, versus drinking as a reaction to feeling thirsty or being dehydrated. Does that make sense? So we really want to make sure that you are intentional with your fluid intake so that you stay hydrated throughout the whole day. And it doesn't become 10 o'clock at night and you're trying to chug the rest of your water, because that's not going to go over so well. Okay, so if drinking is painful for you, try taking small sips. Do not chug or gulp down your water. That's going to not feel so great with your stomach, right? Especially after surgery. So maybe you want to try a sippy cup. So by drinking from a sippy cup, it forces you to drink more slowly, and you have to take smaller sips. So that is a really good tip to try if you find yourself just drinking water too fast and gulping it down. Something else that you can try if water is, or if you're having a hard time drinking water because it feels painful, is change the temperature of the water. So try room temperature, warm or even hot water, as opposed to cold water. That's going to be easier for your body to handle. So definitely try that if you're having that issue. And then this is a big one. If you are already dehydrated, it is likely that drinking is going to be painful for you. So we don't want to get you to that point, because if you're at that point, you might need some IV hydration. So let's avoid that and make sure that you stay hydrated through drinking water throughout the day. Deal? Okay. So if you have any other questions about reaching your fluid goal, be sure to reach out to me. If you are not already a member of our nutrition program, be sure to subscribe to that, because you get unlimited access to our group classes and me. So like I said, I'm Zoe Schroeder, your registered dietitian, and I'll see you in the next one.